Team Synergy. My name is Cheryl. I am one of the medical estheticians and laser specialists here at our North Raleigh location. I have been with the company for a little over 3 years, and in this segment, I'm going to be educating you on laser. Specifically, we're going to be talking about Moxi laser and broadband light treatments. So lasers can treat a large variety of skin concerns, from superficial pigmentation to acne scarring, fine lines, even rosacea. So Moxi is a non-ablative laser, and what that means is we are not removing the top layer of skin. Instead, we are creating microchannels throughout the face. Think about aerating a lawn and just kind of putting the fertilizer into the lawn. That's kind of what we're doing to your skin. But the plus about this is we are not breaking the skin, so you're not bloody, you're not leaving with blood on your face, which is a really nice perk to Moxi. So who can get Moxi laser? Just about everyone. I treat clients as young as their 20s, upwards in 70s and 80s. It is good for anyone who has concerns that Moxi will address. Skin tones, any skin tone client can have Moxi, which is great. So the fairest of the fair, and then our beautiful ethnic skin tones can have it done, and there's no risk of hyperpigmenting, hypopigmenting, stuff in that category. The other lasers, there is limitations with it. Downtime with this laser is also really light, little, not too bad. Like I said, you're not going to leave with blood on your face. Swelling is very minimal. Usually you leave looking slightly pink, like a sunburn. The next day it actually turns into almost like a golden tan, and then you start to have kind of that rough skin happening. That's basically your cells turning over, pushing old skin cells up and off. Along with the rough skin, you will see darkening of the pigmentation. That is your actual sun damage coming to the surface, and it's going to slough away in roughly 5 to 7 days, depending on how much pigment you have to come off. So we have 2 different levels of Moxi. The first one is our level 1 and 2. This is really good for someone who wants to combine it with our broadband light treatment, which we're about to talk about. And then we have our Moxi Plus. This is a really great standalone corrective treatment. Basically, the biggest difference is one, it's going to go deeper in the skin. There's going to be more passes, so more coverage. So we're going to hit more area of the skin, versus the lighter one where it's more of your maintenance. Maybe you've had some lasers in the past and you just want a little refresh, or you're combining it with BBL, broadband light. BBL, broadband light, is actually not a laser. It is a photofacial. So it uses wavelengths and intense pulse light to fragment, break up the melanin in the skin, or dilated capillaries, broken capillaries. There's a lot of things that broadband light can fix. One of my personal favorites is a lot of telangiectasia on the skin, which is those broken capillaries around the nose. Maybe you have a sunspot right around here that's really large and has been getting darker over the past 5 years. Those are just a few examples of correction that it'll do. So who is a good candidate for BBL? A lot of people are an amazing candidate for BBL. It is not as universal as Moxi is, which is why we do require a consultation prior to treatment if you have not been with us before. The consultation will also include picture analysis of your skin. It's a really good time for us to look at a high depth picture of your skin, go over concerns you might not even have realized that you had, and come up with the best game plan and treatment plan for you. A lot of patients choose BBL over some other laser options because of downtime. It's going to be a lot less. Some clients don't have very much of a downtime. You might notice some browning from some sunspots coming up. You might have a little extra redness in the areas we treated, broken capillaries. But overall, it is very manageable. You're able to apply makeup that day. You will leave with moisturizer and sunscreen on your face. And then if you wanted to put on foundation, concealer, you're more than welcome to. Overall, combining broadband light with Moxi laser is a patient and provider favorite treatment. Personally, I love it. The outcome is always great. Some clients need more than one treatment, so just keep that in mind when booking it. But we go over all of that in your consultation, what to expect, we'll go into more details and fine-tune questions as well. Now we're going to show you a demonstration of the treatment so you can see how quick and easy it is, what to expect, what the machine looks like, and what the patient looks like during the treatment. I hope you guys enjoyed that demonstration of the laser treatment. Thanks again for attending our session. For additional info, go to our speaker bio and click Request Follow-up. Be sure to enter code PERFECTCOMBO to receive 500 points for attending this segment.